My name is Iman Nazari Simmons, and I'm San Francisco General Hospital's Chief Quality Officer. So the impetus behind Lean, or Toyota Management System, was to acknowledge that we are building a new seismically safe acute care hospital, and San Francisco General is also preparing for healthcare reform. So in that context, we wanted to take the time to stabilize our processes and take the time to have our work focus on the patient's experience and improve our staff's experience. One, we know that there's way too much waste in healthcare, and San Francisco General is no exception to that. Some experts in healthcare say that 50% of what is in healthcare is waste. Right now, our processes are perfectly designed in some cases to have patients wait too long, for providers to be frustrated with not having the materials and the supplies that they need. At its core, Lean is about driving out that waste so it can free up staff to provide the care that they desire to provide to our patients.
I'm Dr. Ron Labugan. I'm the Medical Director for the Urgent Care Center here at San Francisco General. We see about 29,000 patients a year. We offload the emergency department because many of our patients who would otherwise go there for care if we didn't exist. We had 2 patients that were working with us on the urgent care team. They were invaluable in giving us input from a patient perspective. You know, one of the patients I actually had first encountered because she had written a complaint about care that she had received in the urgent care center. And I remember talking with the nurse manager at the time about it, and we read it and we said, she's right. This is exactly what happens in the urgent care center. I was just really so pleased to see that we were able to involve her in activities in urgent care that we were doing to improve the patient experience.
My name is Victoria Mendoza. I am a resident of San Francisco. I was born in Mexico, and I came over when I was 2 years old, and that's when I was first exposed to San Francisco General. I had tuberculosis. I was here for approximately 2 years. I had a visit to the urgent care, and I felt that I was being mistreated, and so then I wrote a complaint letter. It was answered in a way that I hadn't expected. I got 3 different calls. And then after I got 3 different calls from 3 different departments, then I actually got a call saying that there was a project that they were working on regarding patient experiences.
In this initial observation part, we observed staff and we also observed patients. When we were observing patients, what we would do is actually time each step and time each wait step and write down everything. And that was valuable information later for us to actually see what happens with patients and to be able to quantify it. With staff, we took maps of our clinic and we wanted to see how our staff moved around the clinic, what the motion was. Because motion is one of the sources of waste in a clinic. The Lean process, when it's applied to healthcare organizations, is always centered on the patient. The patient is the first thing that you think about when you think about a process. Is what you're doing actually providing value for your patient? Because if it's not, then you should look at eliminating it because it's just waste.
And it was amazing to sit down. When you were sitting down with the patient, they were so shocked at the attention that they were getting, number one, and the other thing was that they were happy to just give this information and give their feedback. And just about all my concerns were somebody else saw it, somebody who had the power to change it. Just in signage that doesn't require a lot. I think that the mindset of the staff was actually affected because they saw that the administration was actually interested in their job and what they could do to make their job easier. So making their job easier makes it easier on the patient. It's just a snowball effect. So it will the changes will make a big difference.
We had several people, administrators and frontline staff alike, who had their eyes opened, actually experiencing what patients experience, the wait times, the questions, the good things about interacting with our staff, and maybe things that didn't go so well. But when you see the effects of it and how it can really streamline things and make things better for a patient, there's nothing more satisfying than that for those of us who are here and are dedicated to working with our patients here.